cranial nerve. Great, okay, so confirm for me your first and last name, please. Okay, and have you experienced any changes in smell? Okay, I'm going to be inspecting your eyes, including the pupil sizes. Okay, so just a visual inspection, that's all it is. Okay, I'm just looking wherever you want to, it's fine. Okay, I'm just going to mark down my findings every so often, okay, just as a matter of routine. Okay, so first of all we're going to use the Snellen chart here. I want you to close over your left eye for me. I'm going to point to a letter, and as soon as I point to it, I want you to the best of your ability, to guess what it is, okay? Or tell me what it is if you're not sure. Guess. Okay, here we go. So keeping the left eye closed, here we are. Okay, that's not bad. Now I want you to close over your right eye for me. So you can put your hand over or just wink. That's right. So I want you to read the same two lines backwards. Okay, here we go. Keeping the right eye closed. Okay, now what colour do you see here? This line. What colour is that? And what colour is that? Okay, which of the two, if any, appears easier or brighter to see? Okay. Yep, so we're off to a good start. So no worries there. Okay, just going to check your pupillary, it's a very hard word to say, reflexes. I'm going to use a light. It's been a long day, I'm very, yeah. Now I want you to look forward for me. Okay, I'm going to shine the light from one eye to the other, okay? So just looking forward for me. Go. Good. Good. Okay. Good. Very good. All right. Okay, so just looking for any sort of defects there. And just one more time. Okay, just looking in the opposite eye now. Right. Yep. So that's good. Alright, so now I'm going to be checking your accommodation reflex, okay? It's a very complicated name for, we're just testing your focus, okay, the ability to focus. So I want you to pick a spot behind me on this back wall here, anywhere you wish, and just look at that for me. Okay, that's great. And I want you to look at the tip of my pen light. Okay. Now again, pick a spot behind me, please. Stare at that spot. Could be the same spot as before or a different spot. It's entirely up to you. Keep looking at that spot for me. Keep looking at the spot. Okay, now look at the pen light. Very tip of the pen. Okay. Good. And again, if you can look at a spot behind me. Okay, and now look back at the pen light, please. Okay, and relax for a second. Okay, I want you again now to look at a spot behind me. Okay, keep looking at that spot behind me. Okay, now I want you to look at the pen light, please. Very tip of the pen. Okay, right, that's all done. miss out on the Ishihara chart for now. We're going to go over to the visual field test, okay? Okay, so I want you to cover your left eye for me, okay? And I'm going to be doing the same, albeit on my right side, which is the mirror image of your left eye, okay? I'm going to be bringing in my fingers, twitching them like that. I want you to tell me when you can see them, okay? So keeping the left eye closed. Keep looking at my nose, tell me when you can see the fingers. Okay, now you guessed it, we're going to be closing over the right eye this time. I'll be keeping my left eye closed, so looking at my nose, tell me when you can see my fingers twitching. Okay. Alright, and relax. Yep. My eyes feels a little bit strained after doing that, but yeah, just give yourself a nice relax, okay? Alright, so we're going to be performing a fundoscopy now, okay? So I'm just going to be checking the surface of the eye, okay? So I will be shining a bright light into your eye, okay? But I'll only be shining it into the eye for 2 seconds, okay? So 2 seconds this side, 2 seconds this side. Alright, so I'm going to be shining this in your left eye, bright light in your left eye in 3, 2, 1. Done, all done. And shine the bright lights into your right eye in 3, 2, 1. And we're done. Okay. Bit of a tongue twister that. So I'm going to write down my findings and then I'm going to be doing another quick test, okay? Okay, all looks well so far, so that's great. Okay, now I'm going to look for a sort of reddish orange reflection there in the pupil, so I've got to change my setting here. So once again I will be shining it into your eye, okay? Again for 2 seconds, okay? So shining a bright light into your left eye in 3, 2, 1. Okay, we're done, and we're going to be shining a bright light into your right eye, 3, 2, 1. And we're done. Okay, well done. Okay, everything looks good in that department, so that's excellent. Okay, so I've got some mydriatic drops here, okay? I'm going to be putting these into your eyes, dimming the lights and having another look at the eyes, the optic disc and the vessels, okay? So I'm going to be dimming the lights in just a moment. First of all, I just want you to raise your chin ever so slightly for me, okay? Just one drop in each eye. Should be enough, okay? So that's fine, keeping still. Okay, good, keeping still. Alright, well done. Okay, so I'm just going to be dimming a few lights here. Okay. So we're just going to be taking a look at the optic disc and the vessels, okay? So it's all actually see towards the back of your eye, believe it or not. But you don't have to do anything, you just look forward for me. And again, I'll warn you when I shine it into both eyes, okay, for 2 seconds, and then we're done, alright? So shining a bright light into your left eye in 3, 2, 1, and we're done. and into your right eye in 3, 2, 1. And we're done. Okay, well done. I understand that's a little bit uncomfortable, so that's it's one of the hardest tasks to do, so well done, alright? Okay, that's our back on. Alright, a few notes here. Okay, we're doing well, so all is looking very good so far. Okay, have you experienced any double vision at all recently? Okay. Okay, so I'm going to be checking for any restriction of eye movement. I want you to follow the tips of my fingers. Okay. Just checking I've got the right distance from you. It's fine. Okay, so follow the tips of my fingers. Eyes. Keeping the head still, just using your eyes. Good. Good. And relax. I'm going to do the same on the other side. Okay. So again, keeping the head still. Look at the tips of the fingers. Okay, just observing your eyes as you do this. You don't seem to have any obvious restriction of movement, so that's fantastic. Keep following the fingers. Good. Good. And relax. Well done. So that's cranial nerves 3, 4 and 6 all done in one big swoop there, or small swoop. So that's very handy. And was there any double vision at all during that task we just performed? Okay, so fine touch sensation I think we'll do next. So we have cotton wool or Q-tip, whichever you like to call it, and I'm just going to brush this on your face so you know what it is, how it feels. Okay, so that's how it feels. All right. So I'm going to be feeling across the face in different parts of the face, testing various cranial nerves. I want you to tell me if you can feel it. Okay, here we go. Okay. Good. 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 Okay. Okay. Now, did it feel more or less the same on both sides? Quick note there then. Okay, so this is what we call the pinprick sensation. Okay, so it's the same as we did before, only it's a slightly sharper object. Okay, I'll be very gentle with this. So again, I'm going to show you what it feels like to start. Okay, nothing scary. Okay, so again, I'm going to be touching in those same 6 spots. I want you to tell me when you can feel it. Okay, or rather, sorry, if you can feel it. Okay, there we go. As like I said, it's very late, so yeah, very tired. Okay, good. Well done. Okay, good. Well done. Okay, so now, once again, I'm going to ask you if it felt more or less the same on both sides. Yeah. Okay. That's what we're looking for. Good. Okay, if you could open your jaw for me. Okay, and close. That's good. Okay, if you can clench your jaw for me. Okay, that's good. Now I'm going to be attempting to close your mouth. I want you to try and keep it open as best you can. Okay, so open your mouth. There we go, and don't let me close. Don't let me close. Well done. Okay, now if you can keep your jaw closed for me. I'm going to be placing my finger across your lip, just on your upper lip there. There we go. Testing your reflex. Okay, one more time. Okay, that's excellent. Well done. Okay, we'll do some facial expressions now. This is the really fun part. I want you to raise your eyebrows and leave them there for a moment. Okay, good, relax. I want you to close your eyes and not let me open them, okay? So close your eyes, don't let me open them. Resist, resist, resist. Wonderful. Good. Okay, puff out your cheeks for me, don't let me close them. Okay, that's good. No problem so far. Okay, if you can purse your lips almost as if you were applying lipstick. Yeah. There we go, and a big teethy grin for me. Okay. Have you noticed any change in taste recently? Great. And have you noticed if your hearing sounds louder than normal? Okay, make a quick note of that. So, I'm going to physically inspect your ears now, okay? So keep looking forward for me. Let me just have my light on here just to check the back of the ear. Okay, good. Does it hurt when I do that? No? How about that? Okay, finally, how about that? Is that okay? Okay, quick look on the right side. Okay, just a quick look at my light. Okay. Oh, does it hurt when I squeeze there? Okay, now I fold the ear over like that, is that okay? And how about that? Is that okay? Okay. Oh, good. Okay, so physical inspection of ears. That's fine. Okay, so let me test in your hearing ability now, okay? So I'm going to be covering over one ear, whispering either numbers or a word in the other, and then I want you to tell me what it is that I whispered, okay? So we'll start on this side. Kangaroo. Okay, good. 81. Okay, well done. 72. Okay, excellent. Brilliant. Well done. Good. Okay. Tune fork time now. Okay, so I'm placing the tuning fork here on the back of the ear on the mastoid bone. Okay, I want you to tell me when you can hear the sound and when it stops. Okay, so say now when you can hear it, and then stop when it stops. Okay, so this is the sound you'll hear in a moment. Okay, so here we go. Starting on this side. Okay, tell me when you can hear it and when it stops. Okay. Good, one more time. Okay. Okay, good. Now we're going to be performing the Weber test here. Okay, so we're placing this on the top, on the middle rather, of your forehead. Okay. So we're looking for bone conduction here. I want you to tell me, does it sound the same on both sides? Okay, we can do this a couple of times. All right. Okay, did it sound the same roughly on both sides, or was one side very loud compared to the other? Okay, try again. Let me give that a bit of a louder whack, sorry. Again, did it sound more or less the same on both sides. So that's a normal response. Right, I want you to open your mouth for me and say ah. Ah. Okay, that's good. Okay, if you could, in your own time, swallow for me. Okay, and if you can give me a cough, just a quick. Okay, great. Okay, now for the final test here, very simple. I want you to poke your tongue into your cheek. I want you to press against my hand, okay? So I'm going to start on this side. So tongue in the cheek, press against my hand, press, press, press. And on the other side, press, press, press. Okay, that's it. So I've completed the cranial nerve exam for today. I haven't seen anything that causes me any concerns. I won't be referring you to any specialists today. Okay, so well done. Complete clean bill of health for you. Alright, so maybe we'll see you in a year or two from now. We can repeat the whole process again. Okay, well done, and we'll see you in the future.